This is the Think Again podcast. I'm Scott Jens, your host, and today's episode is titled Driving Your Practice Through Co-Management. Our guest is Dr. Pam Theriot, Clinical Director of Dry Eye Relief Center at Lusk Eye Specialists in Louisiana. Her experience in patient care, co-management, and patient education have led her to be an international speaker and author, and she's really got some great advice. Dr. Theriot, welcome to the Think Again podcast.
Thanks so much for having me, Dr. Jens. I appreciate being here.
It's a thrill to get access to somebody who's doing things the way you are. Let's talk about ODs, right? They're broad. Our colleagues are broad in the range of co-management services that they give. When you do co-management in your clinical processes, what does your version of co-management look like? Pick a condition, pick a relationship. What does that look like?
Well, we co-manage many things here, but our bread and butter is cataract surgery. And one of the things that I speak about often is optimizing the ocular surface prior to having a cataract or refractive surgery. As a dry eye specialist, it's something that I will do with the patients as they get referred in. But one thing that I've heard from my colleagues, both in ophthalmology and optometry, is that they would like the patients to come into the ophthalmology clinic ready to go so that the ophthalmologist can give props to their optometrist saying, Dr. Jen sent you here for your cataract surgery, Mrs. Jones, and you are looking great. We're going to get that scheduled. And of course, if it doesn't happen every time, then we're going to have the resources to prep the patient and get them ready and let them know. But I do have a few key things that I like to have patients do before their cataract surgery.
All right.
You ready to hear about them? Okay. So one super easy thing to do is to have your patients have some kind of pre-op care kit. Many companies make these kinds of pre-op kits that have lid cleansers, warm compresses, maybe an artificial tear and a nutraceutical. You can obviously create your own from whatever your favorite products are, a preservative-free tear, and you want them to take simple lid and lash hypochlorous spray cleanser. You want them to have a warm compress mask and maybe a vitamin, a nutraceutical omegas, right? So you can create from your favorites. This is what we're getting you ready to have your surgery, whether it's LASIK, cataract, even glaucoma. You want those patients to heal well. And I think often patients understand that from other specialties that they've gone to. Like if they're going to have a shoulder replacement, they may go to physical therapy ahead of time to strengthen that shoulder so that they recover faster. So I think that we can expect more from our patients, especially as they've become more savvy over the years, that they know that they need to prep for their surgery and just give them the supplies they need to prep.
Oh, I love the focus on thinking about co-management as a broader continuum than just send the patient for a procedure and then sort of make sure that you and the doctor with whom you send for the surgery, you have an agreement and what's in the best interest of the patient for how things are done after the procedure. Is it more and more common that optometrists are getting involved with getting patients properly prepared in advance, or do you think that too few of us do that?
I think it is getting more common, especially in the days of just sending them to the surgeon, have the surgery, and then you're doing that follow-up on day one. The post-op day one is so important. And if you know that your patient is ready to go when you send them, then you're going to feel more comfortable getting that patient right back to you. And Mrs. Jones, as I was talking about earlier, is going to feel more confident as well. Well, Dr. Jens got me prepped. I knew I was ready when I went in. I knew what to expect from the surgeon. They did a great surgery, and I went right back to Dr. Jens's office where I've been going for 20 years. That's where I'm comfortable. So I think it really plays well to set your surgeon up for success and to set you up for success on the back end, because you've picked the best surgeon in your mind, right? And so you're getting that quality surgery and you're maintaining good vision across the board and a good relationship with your own patient.
Yeah, and when they have that trust with you, if you can take care of things across the board, that's really smart. Now, let's talk a little bit about intra-professional referrals, OD to OD. I hear a lot of speakers talk about this. We've all pushed for more OD to OD referrals, but co-management's a little more tricky there, right? Because where's the delineation? Do you have any advice for doctors that maybe are referring things they don't do to other ODs and how to do co-management there where it's not so clear who might recommend what pre-treatment or what, where the line is for the post-care?
Yes, I absolutely do, because here in my community, I do get a lot of referrals from ODs. And I think it's great to have that understanding with a specific doctor of, okay, I'm referring to Dr. Theriot for dry eye management. I did what I could do in my clinic because of whatever in-office procedures I have or whatever access to medications that I have. And now I'm referring it over to her for an in-office procedure or a specialty medication that I don't feel comfortable with. Maybe it's serum tears or something like synergimen, where you suspect a neurotrophic keratitis, but maybe you've never seen one. I see them in my clinic 3 times a month, so I'm comfortable seeing that. And so, having a conversation with the doctor that you're referring to is great. I like to refer out to my colleagues as well. I'd love to send out myopia control, right? We don't do that in my clinic, so I want to find providers that are able to do that, and then they know exactly that. Okay, Dr. Theriot's not even going to give them a bifocal before they get to me. So I've got carte blanche on whatever treatment I decide to do because I'm the myopia control expert, right? I think you just need to be clear with the doctors that you're referring to as far as like, okay, just take this patient over when we've got them stable, send them back, or maybe you just want that doctor to continue their care. That would be a good delineation.
I just heard a story when I was at the Illinois College of Optometry at the Illinois Eye Institute about, the patients that are referred from the neuro eye clinic for prism correction. They're referred back to primary care. They might be referred to the binocular vision department, whichever way. And there's a agreement process in a large clinic like that as to who does what step, who writes the final RX. And I think the key you said is communicate and make a decision as to where that line is, because it is a little bit more tricky. There are things that we can do for each other's patients, but the key is making sure the patient, as in with surgical referrals, the patient feels like they're still connected to who they perceive their doctor might be. I think that's a great bit of advice. What are your advice? What would you say about sharing protocols when referring for co-management outside the clinic? I know that you just mentioned you refer to some ODs. Most ODs we're talking to aren't in a large multidisciplinary group like yours. When you have to send the patient outside, or somebody's sending a patient into you, what kind of data do you want? Do you want a whole printout out of the EHR? Do you want an electronic document? Do you want images? Tell the audience a little bit about what you think the data sharing protocols should be as you see them.
Yeah, I think that a good knowledge of what treatment protocols have been initiated, so the patient doesn't show up and is like, oh, I tried some drops. We all know how that goes. What color is the cap? Where'd you get it from? Like, you're just trying to figure it out. So if the doctor sent that already, then you would know what stage in dry eye management did the patient just try some tears, or have you tried 3 different prescription medications and an in-office procedure? It makes a huge difference, knowing what the patient has been through. So as much documentation as possible, I would say, is better. Having a wheelbarrow bring it over is definitely not what I'm after. But
that's the difficult line, right? I mean, it can be that way for some referring doctors. They just send everything.
Yes. It's better to have more than not enough, I guess.
So for your dry eye patients, if a doctor has got topography and other relevant matter, materials, send them over. The more, the better.
Yeah, I think so.
And how about letters of summary, things that give chronological summary? It seems like that's really important. Oftentimes, though, we get letters out of EMRs that are just a summary of a visit. It takes a little time to research back in time, but do you recommend that we think about giving a little bit more of a chronology of history to when we refer patients for co-management.
Absolutely. I mean, if you've been following a patient for 5 years and you've tried 10 different things, it would be great to know all of that. Even insurance didn't cover XYZ medication, and that's why I switched from one to the other. That happens in glaucoma and dry eye all day long. So it would be great not to have to reinvent the wheel.
And it's just that turns such a light bulb on for me, right? Avoid making another mistake down the line by not sharing things that didn't work. I know you talked about medications that they might have tried, but where a medication wasn't covered for a patient, you just don't want to step back in that same hole. I think that's fantastic. So let's kind of wrap this up. Let's say you're talking to doctors that can refer to a center like yours. They want to do co-management with you and OD or with your surgeons at the clinic. It's writing letters, it's communicating better, but it's preparing the patient better. Is there any one thing you think that optometrists could really do better tomorrow as they're listening to us today? Tell us what that is.
I think it goes back to letting your patient know exactly what the next step is. Mrs. Jones, I'm referring you to Dr. Jens. He is the expert in cataract surgery in this area, and I'm sending you to him. I will be seeing you back. Like, let the patient know what the pathway is as well, because if the patient understands what they're doing, the doctors are going to understand where they are at more easily, and there'll be less confusion and callbacks between doctors and patients.
I didn't expect that answer, and that is absolutely golden. Dr. Pam Theriot, thank you for being my guest on today's Think Again podcast.
You're welcome. Thanks for having me today, Dr. Jens. Appreciate being here.
That's it for today's Think Again podcast, brought to you by GPN Visions, a peer-to-peer learning community to help grow your eye care business.